Good afternoon. Thank you very much for joining us today. We have a really, my job is to say that, but it's true. We have a really exciting session in front of you. We have really a session which is called the European Health Union, Stronger Together with Networks in Action. We want to talk about something which is very popular. We work in partnerships, we work on networks, and we want to take a critical approach, a constructive approach. We know that we cannot implement the European Health Union without partnerships with member states, with partnerships with civil society, with the patients and the agencies. The way to be resilient, to exchange best practice, and particularly on the networks we're talking today, to implement, to make change. We need to have member states on board working closely with agencies to really make a difference. So as I said, I depart from the basis that they are value for money, that we cannot but have networks and partnerships, but also I depart from the basis that we need to harness them better. We need to work with them better. There is this phenomenon that some people have called network ITs, partnership ITs, a swollen number of networks. Do they talk to each other? Are they as effective as they should be? So that's my approach to it. We need them, but we need to work much better with them. So we have the following approach to this. Part one will be 4 important networks, key networks, and we only have 5 minutes each, so I should go very fast, to get a sense of what they do. What is their impact? What are the tools? What is their future? The second part will be looking across them and try to develop 4 areas of learning to set up new networks. What are the issues of implementation, member states, tools, accountability? Because there are common aspects to these networks that we need to apply and learn for other partnerships and networks we are putting in place. So the following approach is, as I said, so we'll have first Sandra Gallina, Director-General, European Commission, Santé, who's going to start by saying why networks are important to implement the European Health Union. And then we'll have Emma Cook, Executive Director of EMA, who's going to talk about the Executive Steering Group on Shortage and Safety of Medicinal Products, MSSG. We had Annette Holt, researcher and international coordinator unit for antibiotics and infection control in the Public Health Agency of Sweden, who's going to talk about AMR One Health Network. As you can see, each one of these networks, there's no questions of subsidiarity. These are public goods. These are issues that Europeans have to work together because they affect each other, like the one that Heiko Rodman-Grosner is going to introduce, the Health Security Committee. He's Director General at the European International Policy Issues in the German Federal Ministry of Health. And then last but not least, we have Charles Vetz, who's fellow of this Health Union Fellowship we're going to talk about, but at the same time, he's head of International Relations Health Directorate in Luxembourg. So these are the 4 people we have on the stage. We have Sandra Gallina, who will start with introduction, but I'd like to introduce as well Jose Chen, who's our young Steiner, and as always, would like you to set questions to him, because at the end, we'll get the questions from you, but also if I am disciplined, and my colleagues, importantly, are disciplined, we'll have around 20 minutes to go to you and get your questions. More than questions, please, come up with contributions about your own experience in partnerships and how we strengthen those partnerships. Sandra, I guess you're online already, somewhere. Welcome. Sandra, why networks? Why networks and partnerships? Why you all love them so much?
I would try to convince you that for 3 reasons, basically solidarity, coordination, but also avoidance of mistakes. It's like a sort of insurance policy. So I hope to keep the attention of the public alive, because as you said, it should be an exciting session. So we all have seen what the geopolitical context has done to all the nations. Even big countries are small in this current landscape. So you may be thinking that perhaps in a network you can punch above your weight. I don't need to go into the gory details of COVID-19, but you all realize that in that part of history of Europe, no member state could face the crisis alone. So, there we started to put in the middle of the room solidarity and coordination at European level. And these, by now, I think everybody realizes, are not an optional, but they are essential. There's no alternative to Europe, some say. Now, from that experience, we went on trying to reinforce our preparedness, strengthening our agencies, building the capacity together in the emergencies. All the panelists that you have quoted are, for me, crucial in that they have a piece of this reality. And this is part of what we call European Health Union, which is not a legalistic concept, but it's, I would say, a policy idea. The health union is not about pandemics alone. I want to stress this because some people think it's just about pandemics. No, the health union is about building a stronger, more competitive, more resilient Europe. These are all the jingle phrases that you have most of the time in all the speeches. Now, let me go into achievements and priorities to see what we can really do. So we have the possibility to address, I would say, better today, the cross-border health threats. We went through the revision, the reform, I would say the major, I would say, work on the cross-border health threats regulation. And, we revisited the mandates of EMA, the mandates of ECDC. And here we enhanced surveillance and early warning systems, trying also to assess better the preparedness of the member states. This is the famous Article 7 visits that we do. We are actually now finalizing the Union Prevention and Preparedness Response Plan, which is not an addition of plans from member states, but it's a plan on its own. It is trying to adopt an all hazards approach. So we are not looking at pandemics only, I want to stress. We want to cover readiness across natural, accidental, man-made, international scenarios, what have you. Now, we are integrating new partnerships, including civil-military cooperation, to ensure that the health security and safeguard of public health is walking hand in hand, And I think that Heiko, who is in the panel, may say more about this because we are having meetings in the HSC about these matters. We try to confront one of the, I would say, saddest challenges, which looks a bit forgotten from time to time, is the antimicrobial resistance. So I'm very happy that an AMR network is also present. Member states are very cooperative in this. They are trying to live by the One Health approach, but this is really very difficult. We have targets by 2030, and I hope they all will try to make to the targets. Now, I move towards the non-communicable diseases. And here the key word is prevention, preventing chronic conditions that are also a big expense for the different budgets in the member states. We are making progress with our Europe Beating Cancer plan. It has been quite successful. And drawing on that experience, the commissioner has decided that we will have also a cardiovascular health plan to address prevention in this particular disease, early detection, screening, to have, I would say, treatment and care in a comprehensive approach. Now, the plan will also try to include, and I was listening to the AI panel earlier, the new technologies. So there is a lot of digital and artificial intelligence to get to personalized solutions. I need to mention also mental health. I get very distressing news every day about mental health, and we are implementing a comprehensive EU strategy. The key focus will be protecting children and young people from the harmful effects of excessive social media use. Stay tuned on this in the future because we will be producing also thanks to the very good cooperation we have with our colleagues in DG Connect and with my dear friend Roberto Viola. And I go immediately into digital health. So digitalization is reshaping the healthcare. And here I mentioned the European health data space. You want a network? well, that is one that will carry quite a lot of import for many patients. I hope that the EHDS will revolutionize the way we will share and use the health data. It's a matter of trust. We need to have the trust of the patients. We need to break down silos to help innovation, possibly to help personalized medicine, and to have also better cross-border healthcare. Now, a thought to the health systems, which are very dear to your heart, Josep, but also very dear to the heart of, I would say, the observatory, but also the work we do with OECD. We continue investing in health systems. We support the member states in strengthening infrastructures, in addressing workforce shortages, and ensure equitable access to care. Here, the word network is perhaps not the most appropriate because there is quite a competition in terms of workforce. And also, I would say the health systems are still not in the network that I would like to have. But, this is perhaps a future thought. We have medical products on which we are working through the Pharma Reform and the Critical Medicines Act, and we are evaluating a plan to revise the legislation on medical devices. Why do I mention this? Because, medical devices is a vital sector in terms of healthcare, but also competitiveness. So whenever we are touching that, we are touching, I would say, things that affect our networks. We go into the Biotech Act pretty soon. We aim to boost Europe's biotech sector. This is a matter that has been entrusted to my commissioner, whom I know is in Garstein. So it is for him to be more explicit on this. Simplifying regulation, accelerating access to market is what we perhaps need to do in many respects. Now, we go into the public health networks. This is, I would say, at the core of the health union. These networks bring value, they pool expertise. So you were asking me why? Well, because, they can build also trust between member states, experts, professionals, institutions. There is a lot of exchanges that go on formally and informally. There is connections of countries that have different levels of, I would say, healthcare. And here we should aim at reducing inequalities and strengthening solidarity. I want to spare a word to the European reference networks. I would say that in a sense, they are important. The public health and the health system performance assessment expert groups, sorry for this very long, I would say, wording, but we have also the coordination group for the HTA. All these entities together are trying to bridge policy differences, practices that differ between the different member states, and try to boost the preparedness, try to boost the actions on prevention. Now, may I say that the EU public health networks face some challenges? Now, what is the first thing that comes to mind as a challenge is fragmentation. Often they remain fragmented. They have mandates that overlap with each other, and we need to create better synergies and to foster better collaboration. How? I don't have the answer. I would like to exchange on this in this very panel. Now, these networks, second challenge in my view, these networks produce very valuable outputs. They produce recommendations, they produce opinions, but sometimes these opinions just stay in a drawer. They're not translated into concrete EU or even national actions. Now, how can we ensure that all that they produce can leave a lasting impact? Well, it would be better to know how to integrate this into policy and practice better. Another challenge that I see is, alas, a remnant of the fact that the money was scant, I suspect, but participation in most of these networks is voluntary. This voluntary nature, how can it ensure that it becomes, that we do not interfere with the representativeness and the inclusiveness of this network for the entire EU? How countries with fewer resources can contribute on an equal footing with others. Now, let me be very frank, sometimes I have also the impression, and this is more a personal view, that these networks produce stuff that remains in expert circles. So how can we increase the visibility? I have mentioned only these 4 things, but I am delighted that today you have mentioned them. Josep, we are here with 4 of our key networks. We have, I would say, the European Medicine Shortages Steering Group that will be somehow finding a vehicle through EMR, because the MSSG has been working with us to coordinate the problems on shortages, and I'm very grateful to that entity. You mentioned the AMR One Health Network. That is also extremely important. Are we doing the best thing in sharing practices, protecting populations and ecosystems? Well, I hope so. We have the Health Security Committee that you mentioned, and here I would like to say it's a cornerstone for the coordination of the health emergencies, the preparedness. It has high-level member state representatives. HECO is just one of them. And, it ensures that Europe acts together when we are addressing health threats. And I would say from different sources, not just pandemic. These are cross-border emergencies of all types. There is the fellowship, which can become, I would say, if nurtured correctly, a good network. It's a network of professionals from across Europe on which I set a lot of store in trying to be a vehicle, in trying to, let's say, through the different cohorts and through the alumni, to have a network like the network that we had so successfully coming out from ECDC. So million thanks to all of you for attending this session, and I look forward also to the questions. Josep, over to you.
Brilliant, Sandra. Thank you. Thank you very much indeed. In few minutes, you managed to give us this European Health Union. Wherever way was born, we don't talk about that, but it's here.
We will never say when it was born.
We'll never say it. We'll never say it.
Concept.
But it's a dream for all of us that it exists. It's real. It has teeth. It makes a difference. And what we hear today is these networks that are the ones that have to make a difference with member states. And you made my job really easily because you already introduced them and you put on the table the kinds of questions I'm going to ask you later. So be ready, because the questions you put on the table are the ones I'm going to ask them, and you, Sandra, so don't go away, because some of the questions are the difficult ones, the orchestration, the implementation, the support, and we want them to talk about that, we want the audience to bring on board, and we want you. You are in the hot seat, remember, as well on those. So start preparing the answers. So, Emma, we start with you. What do you do for a living? What is your network called Medicine Shortage Steering Group? I have a real problem on acronyms, I must say. I mean, the European Union has to find a way for some of us remember all of them. This one is MSSHG, which works with the European Shortage Monitoring Platform, which is ESMP. So I'm not making fun. What I'm trying to say is actually seriously, this is a very serious issue. We see it on the press, in Politico, everywhere. There are shortages, the market doesn't quite work as we want it to do. So this steering group is about doing that. What I'm interested in is, what do you do seriously, and what kinds of tools you have to do that? I'm interested in tools today, not just exchanging best practices. We love exchanging, but I want tools, teeth. What's your teeth?
Yeah, well, thank you very much.
Easy.
Well, let me start with a story.
Please.
So, during the years of the pandemic, we set up a voluntary steering group to manage shortages. And that was to deal with the day-to-day problems that countries were having in ICU medicines as COVID, with no vaccines, no therapeutics moved from one country to another. And that worked. And that was a network that was set up between the European Medicines Agency, the member state, regulatory authorities, and the Commission.
Well, we had the COVID. We're all very worried there. Do we need another COVID to... How many COVIDs do we need to do that in advance?
You always need a stimulus to make something happen. And this made something happen. And one of the things it made happen was the Medicines Shortages Steering Group, which is now part of legislation. So just remember, this was a voluntary network during COVID. And it has now been enshrined in legislation, and we, as the European Medicines Agency, have been given responsibility for managing it. And it's about managing shortages in critical situations. And what do? So first of all, we make sure we know what sort of shortages there are, and that's through a network of single points of contact in each of the member states. So they tell us what they're seeing on the ground. We look at it, we look at what the causes are, and we see what we can do about it. We have at company level, each company has to set up a single point of contact, so we can contact them about their products and any problems in the market. And when we have what we call a critical shortage, we work together to provide recommendations or policy options to try and address that shortage. So, for example, and no shortage is the same. I think it's very important just to make that very clear. So you have to determine what the root cause of a shortage. It might be a manufacturing issue. It might be that a country has stopped supply. It could be, there are lots of different reasons for shortages. So we can, we might need another company to be set up to provide the product. We might need to increase the production capacity. So, for example, at one stage, we managed to get a company to move into 24-hour production shifts to meet demand. We sometimes we find when there's a shortage, we also have mechanisms for sharing between member states. So it's called a voluntary solidarity mechanism. So I'm a country, I have problems with a shortage in one product. We have a mechanism where then you can ask others, can you help? Is there something you can do?
Can we be more predictive than reactive? This is what people here have in their mind.
So
we are all about reacting, the European Union, and now Sandra's telling us
we
want to be predictive.
No, I don't think that's fair. I don't think that's fair.
I like that. You are wrong, you see? It's not fair way of thinking.
Yeah. So, of course, we're working on prevention. First of all, we're asking companies to set up shortage prevention plans, and to tell us, to anticipate a shortage before it happens.
Beautiful.
And then that allows us to find alternative supplies. So it might be another supply within the Union. It might be that we have to import a product from outside the Union. But if we don't know about it, how are we going to do something about it? So part of this is about prediction. So making sure there are prevention plans in place, and making sure that we have early signals when there are possible new shortages, and then putting in place plans to address them.
Brilliant. Emma, one thing that some of us, our keen students, still don't quite get it sometimes, is how these groups work with the new Critical Medicines Act that we're all very keen to study, to understand. Sandra mentioned it. It seems to have a number of tools. There's issues always, funding, regulation. How does that work with the pharmaceutical legislation? How do these elements work together? Because what do you do when a member state doesn't give a damn and, says, well, I don't have the money to do that? Or how do you use these various tools together? How do they relate with each other? Maybe it's a stupid question, I'm sorry. Maybe I'm the one who doesn't understand this, but I don't.
Okay, so, well, Europe is a complex entity.
Indeed.
Maybe you don't understand everything about it.
Thank you.
But of course, before we started, you talked about all the acronyms, and I think we're all struggle with acronyms. But actually, there are lots of things that we can't do as the European Medicines Agency. We have a mandate, a regulatory mandate on the safety, quality and efficacy of medicines. We have no mandate on procurement. We can't do anything about that. That's something that we need another body to do, and the Critical Medicines Act is bringing in some elements there. You asked me, you mentioned something else?
No, exactly as you answered. I wanted to bring the procurement elements.
So in the end, we can do what we can do, but we can't affect pricing and reimbursement. We can't affect buying decisions. Those are things we can't do. So,
but that's what the Critical Medicines Act
and the Critical
gives you.
Medicines Act strengthens some of our roles on the shortages management, but also provides new tools that will help in the overall coordination and joint procurement sets.
It's been very exciting to see this act and what can it do. Issues about whether there's going to be no funding, Sandra, you must be worrying about that for it and for some of the strategies that they put together there. But clearly this is the compliments I want. And sorry to be slightly facetious, it's just I wanted to bring these elements there. But I'll come back to you later because I want to continue talking about tools and mechanisms that, and you have shown us how many you have and how well it works. So I'm moving now to Annette. Annette, we're all excited about One Health. It's the kind of thing that we researchers and others love it. Sometimes difficult to explain to the normal people, the politicians and so on, as we experienced. But this idea that I like to think One Health is much more than animal, environment and human. I like to think of One Health as broader determinants. But I'm not going to ask you there. I'm going to ask about the One Health network for AMR. AMR, I'm saying the obvious, I apologize, is one of the public goods and no one can say subsidiarity. Because if you, the Swedes, are very good prescribing antibiotics, and some other countries whose names I will forget don't do that, you Swedes get affected by it. So what does your network do? Because the idea is very attractive. You bring the environment, the animal, and the human. How does your network operate to tackle finally by bringing these three sectors with their problem with AMR?
Thank you, and thanks also for the organizers for inviting me to this panel. Well, so the name of the network that I'm representing is called the EU AMR One Health Network, and I think the key thing is that we are joining three different concepts into one. So we have AMR, which requires cross-border and cross-sectoral collaboration. And then One Health, as you said, we are basically just doing what humankind knew for millennia, that humans, animals, and the environment are interdependent. And we just forgot that for a little while. And then we add EU to this, so we are 3 representatives per member state, plus Norway and Iceland, so it's 1 representative per sector. We also have in this mixture a stakeholder group which can attend parts of our meeting. And if I should just briefly summarize the main contributions of the network, that would be information sharing, and very, very importantly, that the distance between the Commission and the technical level is shortened. That I think is really a key point here. And we are breaking the silos between the sectors, because it's not that often that we get to meet across sectors.
Because the CDC cannot do that, right? Can they? Because you are the ones, because the CDC cannot go to the sectors. Is that true?
No, yeah, I mean, I'd say that it's true, yes, but we also have, we're fortunate to have the agencies, our sort of main agencies, as members also in the network. So this is a brilliant platform for ECDC, EMA, and also EFSA to communicate with all 3 sectors at one time. And the other way around, we, the member states, can also talk to all 3 agencies.
ECDC was reminding us earlier that we don't see a decrease in antibiotics prescription, but an increase, 1%. I thought the reason, I don't know, maybe I got this number wrong. I just checked it out a while ago. How can we strengthen the impact of your network and ECDC to get this? One of the measures, there are many others, you know. I think the vets are better than us in health. But aren't they, Sandra? I wonder, you're part of the veterinary health. I think they're better in antibiotic prescription, aren't they, Annette?
I won't go there, though. But I'd say that Sandra mentioned the EU Council recommendation on AMR, and I think the targets that are put in there are a very good leading start for us when it comes to reduction for all member states, and their targets have been adapted to each member state's conditions and their current status, so it's in that sense very adaptive, and that I think Sandra also mentioned that it seems as though we are working very hard on this, and indeed we are, Sandra. And we'll do our best until 2030.
Brilliant. The targets, I think it's been a breakthrough, having those dashboards now. You think they're making a difference? You see member states being afraid of name and shame kind of thing? Or they don't care, basically?
No, I'd say that my impression is that most member states do care. And touching upon accountability and regulations, I'd say that it seems that within the field of antimicrobial resistance, the voluntary measures seem to work fairly well, at least on the human side. And for the veterinary sector, we already have the very strict EU regulations to follow.
How would you like to increase your impact? What if you were, Christmas, Father Christmas, sort of, what would you like in your network to have more impact? Because you achieved a lot, and I'm facetious because I've been asked to be facetious, but in reality, these networks have managed an awful lot. So, how would you like to increase more your impact?
I think that the Commission could use us more as like a consulting body, because as I said, one of the things we do is information sharing, but the terms of references that we have, they do allow for subgroups to be established. And we did that during the French EU presidency some years ago. We had a subgroup on making consolidated and structured recommendations for the EU Council recommendation that was then adopted in 2023. And if we could do more of that kind of work, the technical level in the EU would be better utilized, I think, by the Commission.
Perfect. Thank you very much. I'll come back to you also in the same kinds of questions that Sandra has beautifully raised about lessons across networks. Heiko, we really worry about your network. Health Security Committee is something that keeps us awake, our ministers awake. It's an area that no one discusses its importance, its centrality, and Sandra again introduced it very, very much. So how does the HSC, again, similar questions, it's very similar to the AMR, isn't it? Ensures that coordination between member states on security measures?
Well, that's good that you are worrying. We are worrying about many items. Sandra mentioned, of course, the pandemic, and we all remember this. I hope we do. Sometimes I think we've forgotten about it, and we are not ready to be prepared for the next crisis. And this need not be a virus, for example. It could even a war, if you look to our eastern borders, for example. Well, just to give you an impression, what are consequences of this pandemic? And I think it's key that the HSC is the key coordination mechanism for health security in the European Union. And now, for the first time, the ECDC and the Commission are conducting in-country public health emergency preparedness assessments on the member states' preparedness and response.
That's a major breakthrough, Heiko. Yeah. How do the member states react when the ECDC says, they call you, say, tomorrow we're coming to supervise and to look at what Germany is doing? How do the member states?
For example, we are challenging this assessment next year in June.
You have this situation?
Yeah.
Oh, I didn't know that.
Germany will also conduct one of your acronyms, FIPA, for the first time, and you've named it naming and shaming in a way. This will be a check for each country how good they will be prepared for the next crisis, for example. But that's not the only point. If you look, for example, to be concrete and to give you a good example what other coordination is ongoing. For example, the emergency preparedness integrated courses. Some of you might know it as EPIC 11, and there we stick together experts on planning, reporting and training programs for health specialists. And this is founded by the European Union as of Article 11 regulation. Thank you for that, Sandra, for example, for funding this. And we've established new sub-working groups for exchanging best practice as a common approach on specific topics. And these are very helpful, for example, mentioning the civil-military cooperation.
Excellent. I think it's interesting how NATO actually is a good one to work with, and I learned that actually have very strong resilience, health systems resilience actually, Sandra. NATO is very good in these areas, you know, and not only very good in other areas we're worried about, but also in that. So following from that, what kinds of other initiatives and networks could support the political decisions set up by your network? What else do you need? I asked the same questions to the other colleagues that you think could support the work of HSE. Surely some countries may be a bit behind or not quite, you know, having courses together is good, having ECDC doing an assessment is good, but what else? What kinds of innovations we can get for those member states that are perhaps a bit behind?
Well, for example, as mentioned, if I look to medical products and medicines, we have the strategy on measures on medical countermeasures, and we are in negotiations about this, even with Norway, Iceland, for example, and we have to cooperate between not only between the member states, but also between other parts of the Commission. If I mention, for example, for this medical countermeasures strategy, DJ HERA, or for example, DJ ECHO. And we have, for example, this rescue program where we have stockpiles for critical medical articles, for example. This is a concrete example where we have learned from the pandemic. We are working on it, we are not good enough for it, and we have to differentiate what is the regular business, not to be a factor in the market, for example, but if it comes, for example, to medical countermeasures, very specific, for example, we have to be prepared, and we will be prepared.
Very reassuring, thank you. Charles, you're here as head of International Department, Health Directorate in Luxembourg, but you're here also as a fellow of this new generation. We have them all around here in Gastein. They finished the first year, the first generation of Health Union Fellows. And we want to hear from you. They're all very senior. They're very senior member states, sort of civil servants that come together to work on the Health Union. Can you tell us more about it?
Yeah, so let me please just introduce the fellowship, because not everybody here will know it. It's the first year that it was running. It just finished now with our first cohort, and the second cohort is now being recruited. So it's basically a training program and networking program for, let's say, mid-career professionals from health ministries, health authorities, and other organizations in each member states that are involved in EU health policy making. So it requires quite a bit of investment from the participants. So we are speaking about 25, 30 days per year in physical presence, meetings and online sessions, face-to-face trainings, tabletop exercises. But the largest value, I think, in all of this that I see, both from a fellowship perspective and also from a small member state, is really this networking aspect, because I think this is filling a niche that isn't exactly existing, at least in all the countries, and that is at our level in capital, knowing if I work on some sort of policy and I have a question and I want to informally reach out to colleagues, and I might not have all the numbers of all my colleagues from all the countries, I have this network, and I know, and I've used this over the past of the last months, I used it, it made a difference for me. I know we have our attachés, they are doing a great work, they are very important as a network as well, but it works at a different level, and I think both are very complementary. So this networking aspect is very, very valuable in my point of view.
What are the complexities, not on the fellowships themselves, but in general, what are the complexities, because you experience those, on these product champions, or these champions, and Sandra is our champion, and like her, I believe very much on this championship of people of your level of seniority and understanding. But what are the complexities for you guys to work together to build this European Health Union that we so much need and want?
I think, and we may get to it later on as well in the discussion, but I think it's just a challenge, as you mentioned before, with all these networks and committees and stakeholder groups and consultations, especially as a small member state, but I know also the large member states, they have a lot of difficulty with keeping up with all of this. So it's about setting priorities, and you can only set the priorities once you really understand the content and the mission of each of these groups. That's really the challenge I think that we all face, and there's no perfect solution to it. Yeah.
Which brings me beautifully, Charles, to the next part, and I'll go back to you on that, about networks, about partnerships in Europe. But just to say, actually, my title today is I'm Emeritus Director of the Observatory, but I have an enormous privilege, which I hope I'm not going to lose today, Sandra, of being the ambassador of the Health Union Fellowship. So it's really, please go to your member states, pull the jacket or whatever of your ministries, and ask to be nominated to be in this group. We are really, really excited about this group.
We will join the next cohort. So.
Will you join as well, personally? The Health Union Fellows are really applauding you. Colleagues, so now the more difficult questions. You thought they were difficult, these are really difficult. Partnership versus orchestration, that was the title that we put together. Do we need new partnerships? Do we need partnerships of partnerships? I mean, how do we do these synergies, complementarities? Actually, it works much better than I thought. I've been quite impressed about the way that, seriously now, that actually all the agencies come together, they are well coordinated and so on. But some facetious people, some devil advocates will say there are too many, we're going too far. Actually, I'll ask you, Charles, in a minute, you know, small countries like yours, it must be really tough, you know, to go into so many networks. So, Annette, what do we do? How do we orchestrate all of them? What's your perspective? Because I'm sure you are in many, apart from the one you've been presenting today.
Yes, indeed, it is a challenge. But I think there we need to start at home. I do believe that we need to be much better at coordinating ourselves within our member states, so that we know who is part of which network and what.
Do you talk to each other actually in the member state, those who are in different networks? Because I found that sometimes they don't talk to each other. You don't.
No,
talk to
exactly,
each other.
that's true. But if we could be better at having this discussion at home with our colleagues, with our member state colleagues, I think a lot would be better. And that's even for a small country like Sweden. I might not know who's in the Health Security Committee. I do, but I could also not know.
So the work starts at home, right? That's a good one. That's a good one. I love it. Heike, you are a big country. Do you have the same problem, or what is the situation there for partnerships of partnerships?
Well,
you talk to each other in Germany?
Of course we do. You know, we are a federal state. We have to talk in the country a lot.
We are federal as well in many ways, with the county councils. Yeah.
So we know this situation, and you have to build new partnerships, new networks, and to deepen them, of course. Just getting back to the pandemic again and again, sorry for that, but if you think back and how, for example, large member states like France or Germany acted at the first weeks and months, it shows that there have to be coordination between the countries, and that there have to be solidarity with smaller countries, for example. We had great debates with France, Luxembourg, and Germany, for example, for cross-border exchange and so on, and countermeasures and medical countermeasures and so on. So it's a good example that we are now working together between the GDs, for example, and with the member states. I've mentioned these negotiations about the MCMs, but if we look at a broader scheme, it's also important to have this international pandemic agreement, for example, with WHO. We are not alone in this world as a European Union. We have challenging partners abroad. So on the one hand, we have to stick together with other international partners that are confronting us. And if I come back to a different, probably, crisis in the East, you've mentioned NATO. Of course, is really touchy if we talk about war, and if we look at the mandate the European Union and the treaty has, but it's obvious that there has to be a partnership if we are challenging.
So you're very positive.
Yeah,
it works.
Well, it works in a way. It could be getting better if you look what the European Union and the member states have done to evacuate patients from Ukraine, for example. We use the civil protection mechanism for this, and it's working. But if you look at the large scale, it has to be better.
Yeah. Charles, from a big country to a slightly smaller country, Luxembourg. It's good for you because you have lots of leverage to be in all these networks as a small country, but it's tough on you because many of you must be in several networks.
Yes, indeed.
Individuals, I mean, as civil servants.
Absolutely, and I'm also part of the One Health AMR group. For example, I'm the liaison person for the HSC in Luxembourg. So yes, absolutely. I'm sitting in the EU for Health steering group. So when we discuss...
what are your lessons for all that?
The lessons are, I think, that there's two lessons. So I think we tend, if we face a new challenge, we tend to react and create a new body or a new structure to look at it and evaluate it and give feedback. I think that's certainly not sustainable, and we need to see what is out there and how we can use so that we can, multiply the impact and not the bodies. That's one side. The other lessons learned maybe that I can bring, and that is helpful in our case at least, is to have sort of you can call it whatever you want, but it's sort of a cross-network coordinator or single point of contact inside the country. For us, it's easy, of course, to do that.
You do coordinate with yourself very well.
Yes,
in
thank
all
you.
The different networks.
Sometimes I'm in disagreement with myself, but...
You have to remember which hat you wear, right?
Right. But it helps because already just knowing all the committees and partnerships and networks that exist is already a challenge, knowing them and then knowing who sits in them and making them talk to each other. That's not always easy, and there has to be somebody that does it. I don't think it's the Commission's mission to do that. We have to solve this internally. It doesn't apply to every system one-to-one, but I think it does help in some cases. Perfect.
People hate it when I do that. Implementation and accountability. And I'm not saying accountability to Sandra. Sandra, don't worry. It's accountability to each other, member state to member state. We're talking about serious business, Heiko. We are talking about things, your decisions affect the others. So what kinds of financial levers? What kinds of accountability mechanisms? We heard some of those already. I'm going back. You already been very good at giving me some ammunition. But what kinds of additional mechanisms we can use in these networks, not only in this one, in others, to actually ensure that there is implementation? And Sandra was talking about that very nicely earlier. And countries are accountable to each other, not to the Commission, to each other. Annette? And Sandra, I'm coming back to you on that one, sorry.
Thank you for that one. So, I mean, first of all, I'd like to, and that also links to the previous question. I think we need to find also a very good balance between networking and working, so that we've got something to talk about when we meet. So if we look at the legal frameworks, that's one issue where we can clearly see the challenges with working One Health, because as I mentioned also previously, that in the agri-food sector we have the EU regulations, while the human health sector is mostly national competencies. Again, the ECDC is really instrumental for the human health with their networks on surveillance, ensuring that we have harmonization in the data that we collect. But again, that is done on a voluntary basis. Accountability for networks. No, why don't we just stay on the more voluntary path? I think that's a much more better and feasible way forward.
Okay.
That would be my take.
You more prefer voluntary. I don't know how to ask that to Sandra. Sandra, you believe in voluntary? I'm not asking you that, forget it. What are your reflections on that, seriously?
Yeah, I think I will reply to this because I have a lot of notes from the previous exchanges and I would like to
please.
my
I'll bring you up then as well again. Huh?
Very, very, very badly advised, but I will put my iron in the fire. So I would like to, in reply to your main question, basically, I would like to say that health accounts for 10%, more or less, on average, of the production of a country. Let's put it simple. Huh? So, if it's such a huge chunk of our economic activity, we need to have the financial leverage to cover it. So beyond, I would say, the jocularity, we need to all look, for instance, at people like Heiko, who is sitting on top, like many of our colleagues in the HSC, on top of public health systems. In this HSC, we are discussing, for instance, issues of CBRN. So these are biological warfare, let's call it in a different way. And this requires a lot of money. And of course, not all the pockets are as deep as, I would say, one or another member state. But the issue of being together, whether in a voluntary fashion or not, I will enter into that debate later, is very important. Sitting in the HSC, hearing what others are doing, for instance, seeing that if you have hospitals, public hospitals, when there is a moment of warfare coming close to it, you have a bit of a taxonomy on what are the actions. This is giving plenty of ideas. So let me say to you, there's a lot that is going on, and I would like to also specify that member states actually volunteered to have the preparedness checks. So, Joseph, believe me, Germany was very keen on having the examination of its preparedness. We have all the member states trying to have checks of how well prepared they are. So everybody learned the lesson of COVID. The problem is that money is never, I would say, as abundant as you would like to have it. But let me say that one of my biggest challenges is a network that has not been mentioned here, but it's in the name of my DG, meaning in the aspiration of this DG. DG Sante is a One Health DG. I have all the health from everything that is above the soil, because the soil is not for me, but above the soil, plants, animals, and humans. All that health is One Health, the environment too. I am the partner DG for many of the agencies, and also, I would say, the environmental, I would say, observatory. So we have this foursome that make up the One Health agency team. One of the most difficult meetings that I had was what I call the jumbo meeting. A jumbo meeting has representatives at very high level for public health humans, so Heiko and others, and the chief veterinary officers. They are not easy meetings. By now we are used to them, and we go there and we discuss topics like avian flu. Because, you know, the threats may start in the animal part. They may have also some economic impact on the animal part. So it's important that the veterinaries are heard, the veterinaries can have a big role to play, and then, you know, the public health authorities discuss with them, and we try to go in a coordinated fashion. So it is true, there is a matrix, and the tasks sometimes start at home, at national level. As our Luxembourg colleague was mentioning, it's very important that at home you have a vision, but you should not be cluttered by the names, by the, I would say, the, how can I say, all these acronyms and all. You have to see that there is a problem, health needs to be protected. We must have structures that do that. They may be called in different ways, HSC or some other names, but these things exist. The issue is that in this labyrinth, we need to all cooperate to help each other and to be really keen on maximizing the money that we have to achieve the highest accountability towards citizens. Because there I am very, very keen. We are accountable to the citizen. We are accountable to those who consider that health is a right. It's not an optional. Health is a right. Every system you know, is in the competence of the member states. We are very happy to work with the member states to support them. So let me say to you, the competence of the member states is for me a big element of respect, because they have to deal in the end in elections, whether they have been successful or not, the elections will tell. So let me say public health systems or systems, health systems, let us not just put the label public in front of them, are fundamental to convey many of the elements that we have been discussing in terms of network. Whether there are the acronyms or not, Let me spend a word on one concept. Emer was mentioning the voluntary pot. I used to call it a pot. You know, we would have even problems with syringes. We had problems with everything during COVID. And this was a moment of big voluntary actions. We have now tried to encapsulate this, and I repeat, in the cross-border health threats regulation, there is a lot that was voluntary that has been encapsulated in a better coordinated way. But let me say for you, in the Critical Medicines Act, we are going back to this issue of the list of critical medicines, because also that is important. Every member state has a different list, but we need to have a European acceptation of what is critical, what is a critical medicine. And here we stretch this beyond what is the obligation that we have in the pharma legislation, which is about contingency stocks, and the shortage prevention plans. It's also becoming an obligation. So many things were done voluntarily, and they are becoming, I would say, binding. So let me say to you, whilst I fully admit that for national competence of the member state, the word voluntary is the means, is what we should go for. When it comes to legislation, I just heard it earlier in the AI session, companies want to know what is that we expect from them. And in the legislation, in the Critical Medicines Act for joint procurement, for laborative procurement, regional procurement, we will have possibilities to tell people, well, this is what we expect from you. This is what we expect in terms of, you know, there was a big discussion, just to go back on the pharma review, big discussion on the contingency stocks. There was one country that was insisting to have 6 months of contingency stocks. This was extremely expensive and extremely demanding for pharma. We are now back to 3 months, but 3 months need to be covered. And possibly these 3 months should be somehow giving the member states the assurance that should there be a respiratory, like the syncytial, I would say, infections that we had in the past, that they have the medicines that are needed without having shortages. But we go back to what Emer was saying. We have the MSSG, and there, very discreetly, countries can also say, you know, I'm running short of this product. Can we see if I can get it with the rest of the member states? Because every time you say that you have a shortage, let me say there is also a bit of a tendency to have prices that go up. So it's not that you want to go into the square or in the middle of the village and to say, you know, I'm missing this product. No, you need to do it also with a certain confidentiality. So I'm very grateful to Emer for the way she's managing the process in EMA.
Nice
there would
balance.
be many other things I would like to add. The technical level, yes, we need to have more direct lines. And this is all about my my tenure in this DG, I want to have open doors to all the experts, you know, and we are trying our utmost, including with the very, I would say, structures that we have. We don't need new structures. Our colleague was right. We can invite the experts in our structures, and the experts are telling us quite a lot of things that are quite important and are useful also in the exercises that we do to see if we are prepared. Heiko was mentioning EPIC. Yes, it taught us a lot of lessons about how well prepared we are, or how prepared the different member states or even parts of the Commission are when it comes to I would say, you know, these simulation exercises are very helpful.
Thanks, Sandra. That was very, very helpful. You touched on implementation, accountability, and you touched, which was my next point, which I want now to address to Heiko and Emma, which is the support needs. You talked beautifully about the legal, the financial, the technical kinds of supports that these networks need. Heiko, do you agree with Sandra? I hope you do.
Yes, I do. And just to be concrete, scaling the impact of our work at EU level is done by clearly focusing on where cooperation at EU level can create an added value. And this is, for example, we've mentioned it, medical shortages, or, for example, medical evacuation. That's the key.
Certainly, these are beautiful, excellent examples where it needs to be done at the EU level. No one can disagree with any of your committees here. Emma, what's your perspective on that kind of support you need for your networks, and reflecting on Sandra's points? Sandra, I'll bring you at then again, if that's okay, for final reflections.
So I think it's very important that we walk the talk. I think if we're going to manage shortages properly, we need more Europe and we need more data. So if I look at what support needs we need that member states really work together and and look at shortages as a European concept, not as a national concept. Because otherwise you tie up things for national use that could supply others' use. So that's one of the reasons why I say we need more Europe. We need people to think Europe. And we need to have ways of moving stocks quickly around to be able to make sure that we fill gaps should they exist. Now, we have a new task in the Critical Medicines Act, which is about a vulnerability assessment of all the critical medicines. That needs resources to help us manage it. We need to make sure that we can use our European Shortages Medicines platform, which is our sort of database for managing the information that we have on shortages. But we need the data from companies. We need good data to be able to do that. So the only way that we can manage and mitigate shortages is if we have good data and good Europe.
And they come together. Now I have you here, Emma, talking about that. You know, how many times you heard this saying, you want to go fast, go alone. You want to go far, go together. Well, I like to go fast and far. And that applies to our member states. How do we ensure coordination, meaningful involvement of all the member states and go far and fast? So it's a difficult question, I know, but sometimes 2 or 3 member states are laggards and slow down everybody else. If you ask me that question, I won't answer this question. You answer this question.
Well, I can only answer it from the perspective of the European Medicines Agency, where we are in fact about a network of member states that work together and work fast and together and far.
And what's the secret then?
And the secret is...
Why do you get all of them on board going fast and far? Because they're worried they don't have, you know, the COVID, that's what, not you know, the UK, but why is it? How can the others learn? How can you learn to get all of them fast and far?
Well, we have 30 years of experience of working together. I think that makes a big difference.
Yes, and you have the credibility. And,
we have structures in place within our committees. We have networks at national level, and we have a common strategy between the European Medicines Agency and the European Regulatory Network. So we're
Clarity of purpose,
we're
objective,
singing from the
legislation.
same hymn sheet.
Beautiful example. Charles, do you agree with that? Do you, in your networks, do you feel that they all work together on fast and far?
It depends, of course, but I would say it's not only fast and far, it's also fast and far and fair. I think for small countries, it's even more difficult sometimes to absorb all of this. We mentioned a lot of these networks. I think we haven't spoken a lot about the implementation of what comes out of these networks, where, again, it's very often the member state responsibility. But we also know the reality. Very often we have the next set of recommendations on whatever topic, and we haven't really already solved the first one. So there, I think member states sometimes, well, one side we discussed before, that's really the commitment and the high-level understanding of the issues and the national coordination. People have to speak to each other across sectors. The second point is that support for absorbing whatever support already exists, which is sometimes a struggle also for us. I know the Commission is giving us many tools to help implement, to help prepare, to help learn from each other, but we have sometimes struggles to absorb all of this.
Perfect. We're going to do now is, Jose, what are we hearing quickly? I'll give you 1 minute each to react, and then 3 minutes to Sandra then. And I'll come to you for if you can be prepared, very specific contributions. Questions you can. But I prefer, from all your experience, I see all of you, you are in many networks. What can you share with the rest of us? Please.
So from back home, we get a few questions about coordination of networks. They ask, how do we ensure resources and efforts are best optimized and shared between them all, between the different levels of networks?
Your fairness.
And to be shared on the shared agenda. And then, given the cuts of the EU for Health program, how should we understand the current emphasis on networks and partnerships? Is there a shift in priority and strategy, or is there a risk that becomes a way of compensating for this reduced EU funding?
Thank you. Please keep those in mind in your final comments. Can I ask any points, any contributions from the floor, please? You are too stunned, too amazed, too happy? Where? Oh, sorry, Magda.
Thanks. Great discussion. And I'm listening carefully. Well, Magda Rosemary, as a business school, listening carefully because we are on a Lancet Commission on the future of the health Europe Health Union. I see very much the focus on preparedness. And I think it's like we will be just well prepared, but not this active health promotion. That could be a good narrative for citizens on innovation, on driving innovation, on bringing also taking some global leadership, particularly now as we have USAID falling out, NIH is falling out, the American universities come to apply to Europe. I think it should be more than just, I think, oh, this is fantastic, and we learn from COVID, this is great. But I think the European Health Union should be much more than just very well prepared.
I would agree with you. Commercial determinants are much of a threat as any viruses. But subsidiarity, subsidiarity, subsidiarity. Let's see what our colleagues say. Please, quick and short.
Thank you. My name is Louise Baker, and I lead CIANA, the Health Leaders Network, a joint organisation initiated by Careme in Switzerland, the Bosch Health Campus in Stuttgart, and the Health Foundation in the UK. And we bring health experts together to work on common challenges. And just a couple of thoughts on networks. We're always talking about big organisations, ministries, but actually networks are created and implemented by people and individuals. And this is quite often on top of their daily work and their daily jobs. And the most effective implementation is if that common purpose is also felt by that individual who's going to go back to their organisation and actually drive and
influence that change.
Not quite, no. However, What we do in Siana is that we put an emphasis on building relationships, not just within the health sector, but also with organisations and sectors beyond health, but who are needed in order to make those changes back at home.
And that's the beauty of the European Commission, that Sandra can, and she comes from trade, where she had great success as well, can actually talk to other sectors. That's the beauty of it, yeah.
And just making sure that the right people are in those networks, that the ones who want to be in those networks are in those networks, and that their sphere of influence
wherever the member states send.
Well, exactly.
And that has its pros and cons. Please, more points. One more point, please, before I go back to our wonderful panelists. Yes, thank you.
Thank you so much. This is Lela Solberze from Ministry of Health of Georgia. So it was a very good and a rich discussion, but I'm wondering how we could also include countries beyond European Union, because we do also need support, and also this kind of partnership will be beneficial for European Health Union. Everyone knows that pandemics does not have boundaries, and also when we talk about, for example, Critical Medicines Act, for example, in my country, many people emigrate in European Union countries because we do not have access to pharmaceuticals for rare diseases or cancer or some genetics diseases. And if those medicines become available in Georgia, and pharmaceutical companies will supply these medicines to like small countries, it will be also beneficial for the European Union, because people will not emigrate and will not seek asylum in the Union. Thank you so much.
Thank you for the touch to reality. Actually, one good news, the Health Union Fellowships, right, Charles, is opening to countries outside the European Union. And many of the points we are making, you know, borders don't exist, not with Georgia either. So they are well beyond the European Union. One final point, but very quickly, please, because I'm running out of time now.
Yes, I will be very, very quick. I am Elisabetta Zanon, Chief Executive of the European Cancer Organization. I would like just to say that, of course, the European Health Union is much more than preparedness. The European Cancer Plan and the Cancer Mission is really a fantastic example of what could be done when there is will, when there is leadership, when member states, they can collaborate and work together.
Indeed, and Sandra mentioned that already, that this is just a sample of networks. And she's mentioned all the other areas that she have enough time to talk about cancer in particular, or the cardiovascular one that now you're putting in place with our new commissioner. Colleagues, can I have a very short, sharp responses to whatever you like to respond, because it's very difficult to respond to everything. Emma, when to start?
Yeah. First of all, just to reassure you that we're working closely with countries outside the EU, including with accession and candidate countries. So I just wanted to put that on the map. My final minute, shortages management requires partnerships and networks. But it's not just the partnerships that we work within, it's also partnerships across stakeholders. So we need involvement from industry, pharmacists, healthcare professionals, policymakers, payers, and industrial policy.
And patients.
And patients, sorry.
And civil society.
And civil society. Who have I left out? But we have to work together. And if everybody's pointing their finger and saying it's everybody else's fault, that is not going to work.
Love it, thank you.
Thank you. So I would like to pick up on the word implementation. And within AMR and healthcare-associated infections, we are very fortunate to have substantial funding for a joint action from the Commission. And we are in this consortium, 30 countries, including Ukraine, and more than 130 organizations throughout the EU and the associated countries. And this is also a very important One Health platform for us to work in that complements sort of the policy-oriented level. And Sandra said in her introduction that the One Health Network is a policy idea, and I think if we could make that into an idea and practice, that would be great.
Heiko, the difficult question that no one is answering here, I'll ask you and Sandra later. People want more than preparedness, want more networks in other areas that are as important and kill minimum more people than the ones that the viruses are killing, you know. So what do you think of that?
two aspects on this. First, talking about the priorities. Of course, important things first. And these are shortages, for example, MCMs, and medical evacuation in a way, and preparedness for new crisis as well. And talking about this, we have to share best practice, and the member states who have best practices have to go in front of this. And preparedness, from my point of view, is really a key at the moment. And talking about innovation, crisis also always causes innovation in a way. If we look back about vaccination, for example, if we now talking about digitalization, if we look in the future, for example, patient tracking for medevac, these are important things where innovation comes with it. And in the end, sorry for that, I have to drop a little water into the wine. We're talking about the European Health Union. And to make this point at the end, the European Health Union is not an institution, nor it is clearly defined term. We have to rethink about this. We won't have a common health system or health social security system in Europe. Yeah, just
but there
to make
is something called the European Health Union, don't you think?
Not to misunderstood. My country is, of course, in favor for deepened cooperation in the spirit of shared solidarity. Yeah?
And I think that's what the European Health Union is. Charles?
Yeah, just jumping on one point, I think that was from the audience that was very important, and we haven't spoken so much about it. We speak about networks, but what we actually mean is member state groups and committees and so on. There's all the NGOs out there that very often do sort of the last mile in the implementation. They do a fantastic job, and I think it's also our job as member states to give them through the EU the resources that they need to this, and to also give them the recognition.
I think that's fitting words, what I wanted to say before involving Sandra to give us the final words. In spite of me being facetious and pushy, I think there's an awful lot that we have achieved. And Heiko, maybe there's not European Health Union, I don't know. Well, what's happening, it is an European Health Union. And I think one way or the other, innovation now, member states are telling Sandra, please put HTA together, and you're doing that. Please help us to understand the evidence. Germany is very big, you have it all. But some of us are a bit smaller, and we need that kind of support. We need to work together. And I think, sorry, now is my opinion, that the small countries that want to work together, the Commission should support them to introduce innovation, to introduce measures. But that's my opinion. I'm sorry to say my opinion. I shut up so far. Sandra, please wrap us up.
Yes, be bold. Opinions are welcome. We support big and small countries, not just the small countries.
Absolutely.
And we support them because you were mentioning this going fast together. Sorry, there's no time for anyone here. Let me say, I hope some of you read the Draghi report, and in particular the section concerning, I would say, the health issues. There is no time. There's no time. We need to work. I would say, if I were to use an image, the fact is that we need to achieve a lot with the little that we have, and there is a lot of expectations because people know what to expect. So thank you also for Elisabetta, who said that basically the health union is about much more. It's obviously it's about prevention, it's about many things that we are doing. In a small panel, we focused on certain topics, but let me say that we are also including in the EU for Health some of our accession countries, acceding countries. Some of them are already members of the EU for Health, thanks to the generosity of the member states, because let me recall that some of these acceding countries are not paying the full fee to participate in the EU for Health, but their fee is partially paid by the member states. I would like to really give you one piece of real advice. Networks are what we make out of them, what we as persons, what we as institutions, as officials, as civil servants make out of them. So let me say to you, a network can be as good or as bad as we want it to be. And you know, I am very proud of all the networks that we have with the member states. And I think that there has been a lot of generosity going around over the last few years because everybody understands the plight. Heiko mentioned a lot about this transfer of patients. Let me say that EWRS is something that requires a lot of work from DG Sante, but also DG ECHO, because we are not only transferring patients within Europe, but we are transferring patients also from outside Europe. And I will spare you the names of the countries because it's several countries that, you know, can have patients being transported into Europe. I would like to finish with a piece of advice for us all. And it comes from my, I would say, old Latin. The first thing, and I am a real believer in this, is that labor omnia vincit. Work conquers it all. We cannot sit, we need to work. Each of us is, I would say, solicited to operationalize. So One Health is being operationalized within DG Sante. I want Annette to really rest assured that we are not simply living by a policy, but we are implementing it, be it with, I would say, quite difficult discussions within the jumbo meetings, because when you have animals affected by avian flu, you need to know what to do with their products and their byproducts. And this is real money that we're talking about. Then, you know, the second thing I want to give you as a Latin sentence is, in a sense, you know, sic parvis magna, meaning greatness from small beginnings. You have things that you don't know today if they are important or not. We didn't know if certain things were important during COVID, and they blossomed to become different things. So let me say to you, let us give innovation, let us give also the civil society with all their NGOs the space they need to give us ideas, because solutions are not simple, issues are very complex, and going back to the networks, if the networks can help us solving complex problems, so much the better. And I am a believer in that. I'm a believer in that.
That's a perfect way to wrap us up. And of your three advices, Sandra, I'm going to take one, the humans.
Take one.
And
take one.
I'll take the humans, and one of your favorite networks, you have to accept it, which is the Health Union Fellowships. And that's precisely the idea. These individuals motivated, that push boundaries, that work together. As our colleague said, it's humans working together, motivated, and working hard, as you said in your Latin sentences.
Labor omnia vincit.
Labor omnia vincit. There you are. I think if you can put your hands together for this wonderful panel and for Sandra.